so sure, but I think maybe cancer that related to heart.
I feel that the main cancer is lung cancer because there's a lot of smokers.
No, I would say that there are still risks because I heard cancer can be hereditary.
I think if you don't take care well of yourself, I think if it's meant to happen, then you might get it.
I would say that people who have unhealthy lifestyle, they are at the risk of getting cancer.
I don't think it's curable, especially to those who are in a stage 4, and it's like a death sentence for them.
I don't think it'll be easy because I think you have to go through few radiotherapies, then you might have the chance to cure.
Okay, to answer your question, I would like to refer to this report, which is the Malaysian National Cancer Registry 2007 to 2011. When we look at it, this is the 10 most common cancers. The most common cancer is breast cancer, and this is followed by colorectal cancer. Third is lung cancer. Fourth is called lymphoma, which is a lymph node cancer, and fifth is a nasopharyngeal cancers. There is something called a familial cancers, which is hereditary, and there is the other route is we don't know the cause. It could be due to smoking, due to viral infection like hepatitis B in liver cancer, what's it called, HSV for cervical cancer. So environmental factors, multiple factors. So those are the things. There's no such thing as risk-free. Cancer can affect anyone. Of course, it is more common among the elderly, all right? But we also find a young population of patients developing cancer. The pediatrics is a different area by itself. But we can get somebody who is having breast cancer as young as, or cervical cancer as young as 19 years old. So I think it affects everyone in all segments of life. That is a very tricky question, all right? But cancer is said to be curable in certain conditions. Okay. Now you see, cancer has got 4 stages: stage 1, 2, 3, and 4. If we detect cancer very early, say for example in colon cancer, if you detect stage 1 cancer, which is a polyp in the colon, and you remove it, and these patients are followed up over the years, they are basically cured. So is also there are patients with advanced disease that are cured. So I think the most important thing is patients who have cancer is hope to get better. That's the main driving factor. We have to follow the national guidelines, what are cancer screening. Of course, the government has good programs, all right? I just had a patient who I saw who came from Australia, who happened to be holidaying. Government sent a package for them to check their stools to the house. It's called fecal occult blood testing. And actually, Malaysian government has got this program running. It's only people is aware, but of course they don't send to the house. So this patient got it in the house, and both husband and wife sent a sample, and the husband is detected to have blood in his stool. So he went for colonoscopy, and he detected cancer in a stage 1 disease. So these are things that is ongoing, and Malaysian government has already subsidized mammograms with what they call the family planning unit. So there are programs, and I think pap smear is one of the most important tests for a lady who is in a reproductive age, who is married, should have it done every year, because detecting cervical cancer is life-saving. We are basically like any private hospital center that provides cancer care. We have we are able to diagnose, treat, we are able to give chemotherapy, we got a good daycare, we are able to do radiotherapy, as you can see the machine behind. We got a team of people here. We got clinical oncologists, hemato-oncologists, we have palliative physician on board, we have interventional radiologists, pain management, and I myself am a medical oncologist.